So we're going to talk about benefits of co-treatments. So this is Sydney, Meena, and I. Hi. So just to start off with the benefits of co-treatments, the reason why we recommend it to many of our clients at Cutting Edge. So some of the three highlighted benefits are to maximize therapy time, to facilitate generalization, and also to improve the treatment outcomes between disciplines. Jennah's going to talk about need for co-treatment sessions.
So when we kind of determine if your child would be a good fit for co-treatments, we look at a few different things. Usually we kind of get a good idea from the initial evaluation if they'll be a good candidate for this or not. But some of the things that we really take into consideration are going to be your child's activity tolerance. Can they sustain multiple therapies back to back? Do they need to have a schedule that's a little bit more condensed? We can maximize their potential and then build up to where they can do single treatments as well. We also look at their overall attention and engagement. Do they need a little bit more help kind of staying engaged during the activity? Do they need someone to kind of work on one skill while somebody else addresses another skill rather than trying to get one person to cover all of it? We also look at if they have a high sensory need. A lot of times we can pair an OT with a PT or a speech therapist so we can make sure that their sensory needs are addressed while the other disciplines are getting the maximum potential from that treatment session. Another thing that I, for one, like to really suggest it for are my kiddos that I notice they have a difficulty pairing language with specific motor skills. So I get a pretty good idea in testing if the child's having a difficult time understanding what it is I'm even asking. So let alone can they do the skill, do they understand what kind of movement do I want them to do? Can they pair the words with that? And so now we're gonna kind of go into a few little specific examples of how we pair up with our co-treats. And I'll go ahead and talk about the first one. Meena and I currently share a patient, a young man, and he comes in for an OT-PT treatment session. And I'll give you a little bit of an idea about how we pair up. So some of the things that we work on are functional ADLs, so activities of daily living. And a lot of times I'll work on lower body dressing, for instance, while Meena will work on functional strength, transfers, getting him in a sit to stand, while I can work on managing the clothing. Another thing that we often do is we'll do something in our IADL kitchen, where he'll have to put up some items in the cabinet. She's working a lot on weight shifts, navigating the environment safely, where I can work on visual scanning and just functional participation in the home. And then I'll pass it over to...
So I'm going to talk about a young boy who Sydney and I co-treat, so it's a speech PT co-treat. And the one thing that, and as Jennah was mentioning about the comprehension of the verbal commands, so we are doing a lot of sports-related activities with him. So we are playing like a baseball game, a football game. So Sydney helps me in making him understand the different concepts when to kick or where to kick, or for throwing. Are we working on an overhand throw or underhand throw? The spatial concepts, as she calls it, so working on all of those things and the comprehension of the verbal commands in order to participate in a age-appropriate gross motor skill.
And then I'll talk about an example of a speech and OT co-treatment session, which there's one that Jennah and I co-treat together a couple times a week. And during that session, for example, I may be working on the child's functional communication needs and his ability to make requests, especially for his sensory needs. So whether he needs like head squeezes or hand squeezes and some of that like deep pressure input. Also making requests for different activities in the gym that help with his sensory regulation. And then, for example, he has some articulation needs, so I may work on articulation while Jennah's working on the fine motor skills related to handwriting. We also do a lot of like turn-taking games, so she may be working on the emotional regulation, turn-taking, and fine motor skills, and then I may be working on that like peer engagement, sportsmanship, and attention to the activity, following directions. We don't necessarily have to co-treat for the entire session, so we also do a lot of partial co-treatment, maybe for 15 minutes or 30 minutes of the session. It really is just individualized based on your child's needs. So if you think that your child might be a good candidate for co-treatment, or if you're just wondering, please talk to your child's therapist and we can kind of determine if this would be something appropriate for your child. And as always, please give us a call if you have any questions. Thank you.
Thank you.
Thank you.